This is George Geldin of Geldin Insurance Services with an individual health insurance update for the fall of 2016. This message does not contain any information regarding the Medicare open enrollment, which I'll discuss under another message. So, the general open enrollment for individual health insurance is almost upon us. It begins on November 1st and it extends to January 31st. During this time, an individual can enroll or switch to any available individual health insurance plan without having any type of qualifying event. For those people who are covered under Covered California, there is an early renewal period that begins on October 1st. And during that time, those people can confirm or switch plans, or confirm and or switch their income or adjust their income, which will therefore adjust their subsidy level for the upcoming year for 2017. So that early renewal period for Covered California is just for people who are currently covered under Covered California. The big question, as it is every year, is how do the rates look for 2017? And in the past 2 years, California has basically escaped the major rate increases that we've seen in other parts of the country. But unfortunately this year we're not immune. People in California, and especially in Southern California, are going to see rate increases in the high teens, 20% range. Even some people will have rate increases in the 30% range for the plans for the coming year. This is really, really aggravating, obviously. And so the following question is, why is this happening? Why do we have to pay so much more for our health insurance? And the carriers are basically saying there are 3 reasons for the rate increases. Number one, the claims utilization, or the people using services, are coming in at a 3 times higher rate than have been expected. So people are using services at a much higher clip than they have been in the past. Secondly, the cost for RX, the prescription drugs under the plans, have gone up double digits. So that's impacting the rates also, as these RX claims, and especially the specialty drugs, the very expensive specialty drugs, which are spread out over everybody. If one person is taking a very expensive drug, of course those claims are spread out over everybody. Thirdly, and probably most importantly, there are people who are actually gaming the system, gaming our new system in a way it was not originally intended. So we have people who are enrolling during the open enrollment, using services, dropping insurance, and enrolling, disenrolling, and that's not the way the system was intended to be used. And we also have still a lot of people who are not enrolled in the system. So the people going in and out and using services, and the people who are not enrolling, those are greatly affecting the cost of insurance for the people who are covered. So I think that going forward, just as we do every year, people are going to be scrutinizing their plan and making sure that they get the value that they can out of their health insurance, and that they're not overpaying for their health insurance going forward. What is new, other than the major rate increases? What's new for 2017? Well, for those people who are covered under Anthem Blue Cross on their individual plans, which is currently a PPO plan, Anthem Blue Cross is switching from PPO to an EPO style plan in 2017. Their individual plans were an EPO style plan in 2014 and 15. This is the year they went to the PPO, and now they're back to the EPO. And of course, people prefer the PPO style plan because it has an out-of-network benefit. But the reality is, on the Blue Cross plans, the out-of-network benefit on their PPO plans currently is not very rich. So switching from the PPO to the EPO next year is not going to really affect a lot of people, except it's obviously a little aggravating not to have non-emergency services covered out of network on your plan. Blue Cross says over 90% of their claims are with in-network providers, so they don't have a lot of out-of-network claims. and it makes their insurance more affordable. Even with these large rate increases, it makes it more affordable to have an EPO instead of the PPO. Another thing that we're going to see going into next year, and this is mandated by the government, is that all individual EPO and PPO plans that are new or ACA compliant plans will now be assigning a primary care physician to each member. That's going to show up on your ID card. It'll say Dr. Fred Smith is my primary care doctor. Now, don't be alarmed by this. It is not like an HMO. This is not a gatekeeper, somebody who's going to have to tell you what services you can and can't use. They are just putting in either a doctor you're using or a doctor who's close to you in proximity to where your residence is, and putting it on your card. The feeling is, and this is the government, is that by assigning a primary care doctor to you, that it's going to promote preventive care, that people who don't use health insurance at all, they're going to look at their card and say, oh, I'm going to go to Dr. Fred Smith. He's on my card. I need to go see him to get a checkup. So if you're on an EPO plan or a PPO plan, you want to go to your own doctor, you can still go to your own doctor. They're in network. It doesn't affect anything. And in fact, you can even change that primary care doctor after they assign it to you. But don't be alarmed by that, but you're going to see that on your ID cards that will be mailed to you in the first quarter of the coming year. That is it, I think, for this message. Oh, I know what I wanted to do. I have a prop. I'm just going to review this. So, again, early renewal, October 1st, for people who are currently covered under Covered California. General open enrollment begins for anyone to enroll or make changes on individual health insurance plans. That begins on November 1st, and it goes to January 31st. Before I go, I want to just say something that's totally off topic, in that in our extended family and friends from our office, we had just a horrible, horrible, tragic death of a young person who was a parent who didn't have any life insurance. And it was awful, awful, awful. So I just want to reach out, anybody who loves somebody else, who has liabilities, just if you love somebody, just get some life insurance. Really, really important. You can get it very, very inexpensively. Just wanted to mention that. Anyway, have a wonderful, wonderful holiday season, fall ahead, great new year ahead, and we're here to help you. Be well. Bye-bye.